She started early with this stuff, huh? Hi, I'm Dr. Gary Motykie, and I am a board-certified Beverly Hills plastic surgeon. And today we were going to go through Katie Price. The reason we're going through this today is it brings up a lot of different topics in the world of plastic surgery. I think these topics should be talked about a little bit just so patients understand the difference between good plastic surgery, extreme plastic surgery, or when plastic surgery may have crossed the line into too much plastic surgery. And I think she's a good example because nothing drives me more nuts than when somebody starts out naturally beautiful and they end up looking strange in the end. And somewhere along the line, maybe you should have gotten some advice to turn back or hold back a little bit on surgery so that you still look better, but you don't look strange or overdone. And I think we see that with Katie to a certain extent as she's progressing through this world of plastic surgery. She starts out like the normal patient, pretty girl, naturally beautiful, and then starts to gradually add more and more surgery. I think her first surgery was in the early 2000s, and it was a breast augmentation. Not that it's a gateway procedure, but it's one of the most common procedures, younger patients, their introduction to the world of plastic surgery. And she did it respectfully, went from like a B cup to a C cup, and it looks natural and a little fuller, and that's what the majority of women want out of breast augmentation. They don't want the giant beach balls and the huge breasts and all the attention that comes along with that. They just want to have a more normal appearing, proportional body. And I think in the beginning that was a good move for her. I think later on, as she, again, similar with any feature on the body, whether it's the face, the nose, the breasts, she started to continually go bigger, add more implants, add more surgery, add lifts, and all of these things start to add up into the realm of looking unnatural and also risky. So as she moved to that procedure and started adding bigger and bigger implants, what inevitably happens is they become big, droopy breasts, and then she needs lifts and other things that make the surgery more risky, as well as scars. So if she would have just kind of held back a little bit, I think it would have avoided a lot of that, and I think patients should know that. Whether it's, again, the breast, the butt, the face, whatever it is, when you start going extreme, that's when you run into risks of having to do other surgeries to correct why things, how things got so extreme. The next thing we look at with Katie is her nose and her face, and we do see changes of that throughout the years. So I think, again, she starts out doing her nose, typical sort of rhinoplasty, wherein it's narrowed in the bridge, narrowed in the tip, lifted a little bit, and then we see her, again, that nose progressing a little bit and changing. Some of that in the early part could be swelling coming out of the nose, but then later, as we're seeing more and more changes, probably tweaks to that rhinoplasty. For Katie's rhinoplasties, again, she's only in her 20s, maybe early 30s during this period of time, and again, it's a very common surgery to do when you're younger. Now, I think she was a little bit young to start delving into these other type of surgeries, and I think somewhere along the line, things kind of went sideways. So she started out then moving to other parts of the face, which is typical for things like Botox and fillers. But then I think she started getting a little more extreme, and some of the photos we see of her, she's a little overplumped, the brow's a little bit frozen, maybe a little bit too much threading going on. And again, even though they're temporary, they can make you look overdone or strange if they're done in too large a quantities. So in any of these procedures, whether it's Botox, fillers, threads, if you overdo them, it can make you look strange. That's some of what maybe happened to her, and at that point, experimenting with these different things that were making her look a little strange rather than better. And at that point, I would have said, just let it dissolve. These things aren't permanent. If you don't like the way you're looking, let it go. Unfortunately, I think she went the other route and wanted to go more extreme or have something undo those fillers and threads and do a surgery. And at that age, although I think there's a tendency to be doing facelifts and these sort of rejuvenation procedures younger, this is still very young to be doing facelifting procedures. Now, if it was more for changing the shape of the face than aging, you can see some of that as well. But again, I think as we watch her and she decides to not only do the surgery, but go to Turkey to do the surgery, where they tend to do a little bit more of extreme results. I think that's what maybe got her into a little bit of trouble. So when she went there and did the surgery to undo the other surgeries, she went even more extreme, which is nice. She's being honest about it. She comes out in the media and says she's scared, she feels she's overdone, complications start occurring. This is that slippery slope that starts. So once you've entered into this realm of trying to go more extreme, we run into these problems of more extreme results, being scared of the way you look, things are overdone, and patients have regrets. So I think, again, in that realm, in a young patient, she should have probably, or her doctors or both should have started talking to her about doing maybe some little less extreme things before jumping right into a full facelift. And then on top of all that, she does even more surgery. She's trying to undo things, but ending, like I said, on the slippery slope, where she's now falling into the realm of results that can't be undone, and trying to undo them, and chasing her tail around doing surgeries, trying to undo things but make them look better or make them look more extreme. That's when people really pick up on, okay, something's going on here. Something's different about her. Does she look better? As far as standards in the community would start saying, she's starting to look a little odd or a little strange. And even she starts to mention that. I think that last surgery where she went and did the cat eye and pulled up laterally and really went extreme with the surgery, she starts to look different and not necessarily younger or necessarily to normal societal standards looking prettier. Maybe she wanted that, but in a lot of people's eyes, she's starting to look strange. You can again see not only is she looking strange, but when she's talking about her surgeries, we got into the risky part. She literally said she needed blood transfusions. She thought she was going to die. She looks like a monster. All of these things are things you don't really want to hear in the world of plastic surgery. It should be very safe and also not so extreme, because that's where problems happen. That's the dangerous area where you try to combine too much extreme surgery into one. That's when we run into complications. And it seems like she was bouncing right on the border there of having some really serious complications. And then probably an adjustment period, getting used to looking much different and not like herself. So I can only imagine the amount of stress from the physical part of the surgery as well as the emotional, psychological part of doing those extreme surgeries.